Hi everyone, this is Chris with ED Pharmacy. As some of you have heard, we're moving away from using Alteplase or TPA and moving towards the use of Tenecteplace, otherwise known as TNCase or TNK, for the treatment of acute ischemic strokes. This is for several reasons. First, the ease of mixing and administration with TNK is much better. This is a single bolus agent. No infusion is necessary. When compared to Alteplase, TNK has similar effectiveness and has a lower cost. But the good news for you is that very little is changing associated with the care of your stroke patients. Imaging, re-imaging, labs, and monitoring of vital signs, and basically the entire stroke alert process remains the same. The only difference here is that we are changing medications. The first and one of the most important things that I can stress to you is that we are not using the dosing strategy listed inside the box of TNK, seen here in orange. This is the myocardial infarction dosing. We are using a separate dosing strategy seen on the right-hand side of your screen. Using actual body weight, the Tenecteplace dose is 0.25 milligrams per kilo, with a maximum dose of 25 milligrams. So for any patient over 100 kilos, we max out and that patient gets 25 milligrams. TNK reconstitution is considered to be easier and faster than TPA or Alteplase. The TNK box comes with all material necessary for reconstitution. However, it's important to note that the material inside the box is not special, so that you can use your own bedside material if you desire. You will withdraw all 10 mils of the sterile water included in the box or what you find at bedside and inject it directly into the Tenecteplace vial, allowing for all the bubbles to dissipate. This should happen fairly quickly, but you can swirl it gently if necessary, but remember not to shake it. The solution should be colorless or pale yellow. The final concentration is 5 milligrams per mil. After reconstitution and the appropriate dose has been pulled into a separate syringe, it's time for administration. It's important to note though that Tenecteplace is not compatible with dextrose-containing fluids, so it's important to flush the line before and after administration. Administer your single bolus of Tenecteplace over 5 seconds. Flush the IV line following the bolus and document the TNK administration on the MAR. In summary, this is just a new drug, but the process remains the same. ED Pharmacy will continue to attend stroke alerts and help facilitate medication administration. One final important piece, we do not get reimbursed for wasted Tenecteplace like we did with Alteplase. So we do not pre-mix TNK before the decision has been made to give the medication to the patient. Please wait for the final decision to be made before mixing TNK. Again, as a reminder, do not use the dosing listed inside the TNK box. This is for myocardial infarction. And always flush your line before and after TNK administration due to compatibility issues.